See one. We're close to starting. Those of you who are listening in, as soon as we get the thumbs up.
I'm trying to get Commissioner Stanford on here.
Okay. And let's make sure we're talking into our microphones. And they're on when you start speaking. We are live, but we'll wait for Commissioner Stamper to be in. He's calling in right now.
I like your purple.
Thank you. I have a new mask that my friend made for me, and it's purple. So I thought when I go out, I will match.
Well, why not?
So,
I know.
matching my mask.
Good.
For anyone on the call or on the Zoom who's wondering why we haven't started yet, we're waiting for one of our commissioners to join us. So we'll be starting shortly.
And hopefully people are able to call in today right away. They're phoning in. We love technology, but there are some problems. Yes.
Settings got changed on me.
Oh, okay.
It's ringing his phone right now,
All right.
so we should be okay.
Hello?
Oh, Commissioner Stamper.
Hello?
Okay.
Hello, everyone.
We are calling to order the COVID-19 meeting of Thursday, April 9th. I see 3 commissioners present, 2 on the phone. And let's go around who is present. Edna Fund, Lewis County Commissioner.
John Uplenup, Deputy Director with Public Health and Social Services.
Rachel Wood, Lewis County Public Health Officer.
Becky Butler, the Budget Office.
Eric Martin, County Manager.
Support staff.
Tammy Martin.
Candy Hall.
Reba Lester.
And I see we have our prosecutor, we have Edmund, Josh Metcalf, Laura McRae. I can't read every one of those. Suzette Smith, Amber Smith, Steve Walton, Delane Coleman. Who am I missing on there? Any other staff?
It's like
County staff?
Amber
Smith?
Amber Smith's on there.
Yeah. Amber Smith and her sister Suzette. Yes. All right. Take it away.
Okay, so we have I think, a fairly short meeting today, at least from a presentation standpoint. We'll be happy to answer any questions you have. So I'll just go down the list here. I did not hear today of any new cases. John or Dr. Wood, is that we still holding that 17?
We are not. So we
Okay.
bumped up to 18 today. This one took a little bit of time, and we still don't have complete information. This is someone in their 80s who was tested and diagnosed actually last month, but due to issues with the data quality from the electronic lab reporting, we still don't have good contact information. We haven't 100% been able to verify that this person currently resides within Lewis County, but their last known address is in Lewis County, so they are counted as one of our cases, and we're continuing to dig into this to get the information that we need.
And Dr. Wood, do we have any other information that has been requested by Senator Braun in terms of recovery?
So I met with John and with our staff, and we're going to call the people that we know tested positive in Lewis County. We may have to redo that work because we're hoping to have consensus statewide as to what's the definition of recovery. Right now, we have a loose beginning point and a loose end point. So the loose beginning point, is it the date of onset of symptoms? Is it the date of the first test? Is it the date that the test came back positive? And all of those are different. And then in terms of how do you define recovery, is it you're still alive 2 weeks later, so you didn't pass away? Is it that you're no longer hospitalized? Is it that you're off the ventilator? Is it that cough symptoms can last for anybody who's had whooping cough, you know that it can last for 100 days. So are the cough symptoms, we're not going to count cough symptoms going away. Are you no longer febrile? What if you never did get a fever? Some people just have symptoms where they notice that nothing tastes and they can't smell. And that seems to last for a fairly long time. So do you count recovery when all that has gone? So we're going to do our own, because we have our 17 or 18 cases here. I don't think King County is going to be able to do over 600 cases because this is going to be a one-on-one phone call. But we are hoping to get some consistency around the state. So, and I know there's a health officer call tomorrow, and I'm sure we'll discuss this further. So
That's good. I was reading in the Daily O that interim health officer from Thurston County, Dr. Diana Yu, said of the 72 reported cases, 45 have recovered and have been released from isolation. So there must be, what Thurston County is, it's, release from isolation is probably one of the key terms. So getting that consistency, what you just mentioned, I think is really important.
yeah,
So we're comparing apples to apples and not apples to oranges.
good. Yes, that's beautifully put. Apples to apples. So, but we want to know just for those that we know for Lewis County. So we're going to have Donna call those.
Okay. So at this point, we do know we most probably have 18 cases with 2 deceased.
Correct.
Okay. And those individuals were elderly in nature.
Oh, yes, with comorbidities, meaning they had other medical problems.
Medical issues, yes.
In addition to the COVID infection.
Okay. Any questions from the commissioners?
No, I don't have any. Thank you.
Sure,
I don't have any right now either. Thank you, Dr. Wood, for all your work.
sure, thank you.
Yes.
Okay. Thank you.
So on the response side, besides all the great work that John and his staff and Dr. Wood are doing, we've also been working feverishly on a request to both FEMA and Department of Commerce for some housing related to COVID. And so we have a proposal here, which is probably going to go to FEMA today. for some non-congregate housing, and there's a piece in here also for some food service to help support the efforts that are being done to help seniors stay home and stay healthy. And so I'll let Becky talk about the details of that a little bit. And then we also have a congregate housing proposal, which is how we're going to use the Commerce Grant money that we got, about $400,000, to set up a congregate housing shelter, if you will, at the fair to help the spread, relieve the spread of COVID in our homeless and populations and those folks who need a place to go that's somewhat isolated. It's still congregate, but can help alleviate that spread. So
Congregate means?
Congregate means under one roof.
Under one roof.
In one building. There's going to be some separation between the beds there, but not so much to say that they have their own room with their own sanitary facilities. So they'll be sharing some of those things, but we're going to try to keep them separate as much as possible there. So. Becky, you want to talk about the non-congregate proposal to FEMA?
So I think, Mija did a really good job yesterday covering all of the ins and outs and the service contracts that are involved in this. So the total amount that we'll be requesting today for approval is about 2.9 million. That includes the construction, which again was discussed yesterday by Steve Wold in length on what the plan is there. Medical service provider contracts, AMR will also be on contract to provide transport services, cleaning services, and then we also have hotels and the potential purchase of RVs if needed to house those people in non-congregate areas. And then that also includes some construction of bathroom facilities that are specific to this area and some fencing to keep the areas separate as well.
And this all began, I think, with Dr. Wood signing a document indicating we needed to go this route. Could you explain to the audience what that was concerning?
All I did was provide the signature, but lots of work went on with Mr. Meyer and with Mija, putting it together in appropriate language. But mostly it's to protect the public's health. The health officer is supposed to do anything in his or her power to prevent the spread of contagious diseases. And if an individual who has no housing tests positive for the COVID, the virus that causes COVID illness, that individual needs to be isolated somewhere for the duration of the period that they're infectious in order that they don't spread it to other people. So a lot of work went on to come up with a document, which was a health officer order to provide the non-congregate housing.
And that came about because of the cases had been growing, the number of cases had been growing?
That came about, I think that it was a good move by Mija and Mr. Meyer because we had report at one point sometime in the last, I want to say 4 weeks or so, of an individual who had no housing reporting to one of our medical facilities wanting to be tested for the virus that causes COVID illness. And that person was evaluated and felt not to have that. There was another reason for their symptoms, but the point was it raised all of our awareness that we really need to make plans so that because it takes a while, as everybody who's worked on this knows, to come up with this. And so lots of people have been working on it here at the county to have this set up, ready to go.
Okay. Questions from the commissioners?
No, I don't have anything. Thank you.
I don't have anything at this time either.
Okay. So it's now 2.9 million, is that what I heard? And that you needed approval from the board to go forward, is that also what I heard?
Go ahead. if you have an answer for that. I don't think so. I think
Okay.
that what you've done is created an applicant agent situation with FEMA, which is Josh and Robin in Public Works. And so you've given them the authority to submit these things on your behalf. But if you have any comments or questions, we certainly want to make sure you're fully informed of what it is that your applicant agent is going to do. So,
Okay. Josh, do you have any comments you want to make?
Not specifically, but if you have any questions, I'm happy to answer them or find you the answers.
And once again, the timing, so it could be next week. We could have folks coming there for the congregate care or which,
Oh, okay.
I believe so. I believe that's what Mija had indicated yesterday, that the congregate shelter with Salvation Army we were looking at having that up and running next week. John?
okay, John, why don't you go ahead?
yeah, Ed had sent me a press release that the Salvation Army was asking him to put out, which had a date on it, and I wanted to verify that date. So I don't know, John, or maybe that's a question for Mija. Once we have kind of a verification of that date when we think it will actually be open, I'm happy to give the okay to send that press release, but I just had some questions about, how sure are we, and can we be sure about a date when we're saying it's going to be open before we send that out?
Yeah, the latest that I'd heard was that the target date was the 15th. I believe originally it had been the 13th, but yeah, I think we need to just verify that absolutely before we send that out.
Okay, so I think Ed's on the call, and so my message to Ed is, if you have verification of that start date, let me know, send me an updated press release, and I'll get it back to you with any comments or an okay to send.
Okay. Thank you.
No particular update on supplies. I know Andy's working feverishly on some things that hopefully we'll hear more about real soon. Maybe in the morning, he might have an update on that. John, do you have an update on supplies?
Yeah, just a quick update with testing kits that we have been able to receive from the state public health lab. To date, we've received 250 of those. It was clarified for us this morning that those are intended only for use on folks who are either first responders, medical personnel, or people who do not have health insurance. So it's not anticipated that we'll be able to continue to request those, as we will not be able to verify that all of those tests are being used for those populations. We have also reached out to many of the providers who are currently conducting testing in the county, and it does seem that test kits are becoming easier to obtain for them as well. So there may be less need for outside assistance for them to procure those.
So I think it was either yesterday or maybe Wednesday, John, I think you and maybe Dr. Wood were going to be talking to those healthcare providers and hospitals and making some decisions about where to send those test kits. Did you make a decision on whether those are going out or staying in, or how many?
Those are being distributed today. 60 are going to Valley View. 20 are going to Mary's Corner Medical, and 60 are going to Steck Medical Center.
Okay,
And
great.
60 to Steck.
Steck.
Okay, Steck, Mary's Corner, and Valley View.
And then we're retaining
the
10
10.
additional, in addition to the 20 that we had retained before for outbreak investigations
Okay,
and long-term care.
Thank you.
And other healthcare facilities were also called and said that they had sufficient.
Okay,
So Arbor Health was called, and so was Providence.
Yeah, I was going to say, I didn't hear the two big hospitals in there, so they seem like they have a good supply of tests then. That's what we're hearing.
That's what we heard.
That's good. Thank you.
good.
Okay, so county services, just to update, as as Josh reported yesterday, we have put some protocols in place at the transfer station, the Centralia transfer station, to limit our customers to only those who reside within Lewis County. And they will be checking IDs, and that's just due to a real potentially unsafe condition where we had way too many people at the transfer station coming in from out of county, overloading not only the spacing between people, but probably the work that could get done there. So it's a unfortunate but necessary step that we had to take, and I think that we'll probably have to reevaluate that on a regular basis to see what the other available transfer stations or dumps in the area outside of Lewis County are doing about taking customers before we make a decision to open that back up to anyone. So I know Josh is working on that, and he's also been working with the prosecuting attorney's office to verify that what we're doing is okay. So that's where we're at with solid waste anyway. As far as other operations go, I haven't heard of any major changes in what we're doing. Is there any questions about anything anybody has today?
So that order for solid waste goes into effect tomorrow, is that right?
I'll have to check. I thought it was already in place, but it might be tomorrow.
We put the notice out and we'll start the actual physical ID checking tomorrow.
Okay.
And I did get verification today. I talked to the director at Thurston County and they did open their facility back open today.
Good, good.
Oh, good.
That'll relieve some pressure. Thank you. Questions from the commissioners?
No, I just wanted to let you know my battery is just about dead. I don't know how many more minutes I can hang on here. So, and
Okay.
I don't have access to a card. So, I'm actually sitting in the Morton Market parking lot right now. So, anyway, so
I
just
know
wanted to
those
give you a heads
feelings.
up.
Okay, thank you.
I think if you ask IT, they'll get you a car charger for your phone. We'll
Yes.
get that to you
Well,
tomorrow.
You know what? I got a car charger here, but for whatever reason, it is not working.
Okay.
So I don't know what's going on.
Fair enough. I know there's ongoing conversations about building and construction. No real change to the situation on that, but we continue to think about it, talk about it, work with our customers as best we can in those situations. Commissioner Stamper, I know that you've asked a lot of questions about that.
Oh, right.
We
right.
continue to make it a point of emphasis to think about, focus on, think about ways that we can do whatever we can do and still keep our employees and the public safe.
Well, I know you received my, the email. I think you got it, Lee got it, 3 commissioners got it, and specifically, the loan that we were talking about, it's under real estate, and it's a VA loan. There's asthmatic teenager in the house, and then under COVID, I think that does probably warrant some opportunity to do some things maybe that I don't know that fits. It seems like it passes the smell test to me, but
It very well may, Commissioner Stamper, and I think when I talked to Lee Napier today, she had suggested that particular customer work directly with Doyle, and we will do everything we can to help them out.
Great, thank you. Thank you.
So if they haven't already, I'd encourage them to give Doyle Sanford a call, and let's see if we can work something out.
okay, thank you.
Thank you.
That's about all I had.
Nothing about policies?
No
Everything
new
is
policies. I'm hoping that the policy that we have on the third try is going to stick around for a while. So at least through the time when we need it. So
So I just checked with Tamara too. She said the Lewis County Together website is coming along and should be going live fairly soon.
Good.
Hopefully this week, yeah.
good. Announcements. Any other?
No.
Last night, I attended a Zoom meeting with Centralia Downtown Association, and those individuals are very concerned about how they continue to be in operation, considering the situation now. And with all the policies and the potential funding that's coming down, it's really hard sometimes to say, okay, am I covered by this one? Or am I covered by that one? There's a loan process. And they said for us to go to a bank and say, under the COVID situation, we are closed, but our water, our heat, and our mortgage still needs to be paid. And at this point, they have no foreseeable income because they don't know when everything will come off. So there are some people in our small business area that are just very concerned about their future and whether they can hang on. And I know the Century Downtown Association and the Chehalis Renaissance and the East Louis County Chamber, a lot of folks have been working on this Louis County Together website to put resources on there. But once again, you can have all the resources in there when like they're 20 pages long and like which one will fit for me. So it's a tough place out there for our small businesses. Very tough time. And our food establishments, I think, who are doing takeout. It's good, but not really good. And so I just encourage people, Easter dinner's coming up. And there's a number of places in Louis County that will provide you Easter dinner that you can pick up safely and take home and eat. And that will help our folks out there.
Yes.
Yes.
And I don't know about in Lewis County, because I live north of here, but I did go to pick up a takeaway. And while I was waiting, an individual came in and asked if they were hiring, and they said yes. So, that was sort of nice that some people are still able to hire.
Right. Yes. Louis County Together also isn't going to include WorkSource on the state level that can highlight what jobs are available in Louis County, because we do know that UNFI in the Centralia Port area continues to hire drivers and warehouse workers, and Safeway has been requesting people to apply for jobs. So there are jobs out there. It's just difficult if you have another job and can you say you're going to be a permanent employee for those folks? It's difficult. But anyway, there are jobs, and we'll see how we can spread the word out throughout Louis County.
Yeah. One thing I still remember from the 2007 flood at how good Lewis County was at networking those who had needs and those, people being aware of other needs and sort of putting two people together. That really impressed me back in that day.
Yes. And like our quilters, Susie Carpenter and her daughter, Callie Carpenter, have been organizing the troops of sewers in Louis County and making masks. And I know there's an entity in Centralia that needed, I think it was 150 masks. And those quilters got together and provided, and that's just the tip of the iceberg. There's been a lot of people making those and getting them out to people so that they're wearing them when they're out and about to protect others. From what I understand, that is really, you're not protecting yourself, you're protecting others. Is that correct, medical
Yes.
professionals?
Yes.
And wash those masks too, is what I
Yes.
heard too.
Yeah, and be careful taking them off.
Okay. Oh, okay. Thank you. Okay, calendars. I think Reva's put out the calendar, and I think everyone has a copy of it. So next week, I think we start at 3 o'clock. Yes,
For this meeting, yes, we got a couple of days in there where we've tacked on other business type meetings on the front of it. But yeah, I think for the most part, we'll start this meeting at 3 o'clock.
questions from the commissioners? Okay, let's go to correspondence. Anything that's come in that we need to be aware of? Other.
I think we did this piece of business yesterday because it was a possible late addition for the Snyder Road Culvert Project, and I believe that the board moved that forward to their Monday agenda yesterday. So that one's been handled. I don't know if there's anything else.
Nope, that one's been handled. We're good.
Okay. I'll take a motion to adjourn.
So moved.
Second.
It's been moved and seconded to adjourn. All in favor, say aye. Aye.
Aye.
Opposed? Motion carried. We're adjourned. Thank you.
Thank you.
Stay
Thank you.
safe.
Yeah.
Stay